Hi everyone. My guest for today is Anjum Sohail, and she is the founder and nutritionist at Reset Nutrition. She has been practicing nutrition for last 12 years, and we are going to discuss about PCOS, which is Polycystic Ovarian Syndrome. This is very common these days, and people are not aware of the symptoms. So we are going to talk about the symptoms, what are the lifestyle and diet changes that you should follow if you're suffering from PCOD. And yes, our guest, she herself was diagnosed with PCOS when she was only 15, and that is why she's the best person to talk about it today. So please just welcome the guest. So yes, as you know that today's topic is PCOD, that is polycystic ovarian syndrome, and there is only very vague information, and people who are newly developing the symptoms, so they are not aware of it, right? So as people are not aware of the symptoms, I would really like you to talk about some of the early signs and symptoms that we should notice definitely, and once we see that they are there, we should definitely go and check with the doctor.
Um, all these years, I've met a lot of clients who've come to us with no information on PCOS. Main reason probably would have been either they have missed periods or they are not losing weight in spite of trying everything, right from gym to so-called, diets and stuff. And they're like, no, my weight is stuck. And then I will not boast about it, but it's been so many years. Earlier, I would meet 1 in 5 women for PCOS. Now the range is almost 3:5. So it's that common. The symptoms vary from one person to another. It could range anywhere from weight, difficulty in losing weight, or missed periods, irregularity with with their menses. Um, Male hormones being more prominent with them, so testosterone levels are very high, and when that is high, you see hirsutism, that is growth of facial hair, androgen pattern of hormones being on the higher side. Also, a lot of times, difficulty in conceiving, fertility issues is also something that clients do come to us, and these are some symptoms. Now, one person who's finding it difficult to lose weight not necessarily will have facial hair, so you cannot tick list all of this out of your options and say, hey, okay, the out of 10, all the symptoms are similar. Via wherein you compare another client, maybe that client has been able to lose weight but has difficulty with acne because oily skin issues or facial hair, and that affects their what do you call it, the confidence level. To some extent, they are very hesitant on the way you look and the way you dress up. Hair fall is another issue which a lot of PCOS clients suffer. So symptoms ranges from appearance to hormones to mental health to physical appearances, a lot of it together. But in a gist, it is more to do with difficulty in weight loss, fertility issues, male pattern of hair fall, or growth of hair, facial hair, that's hirsutism, and a blood test and presence of cyst in the ovaries is also that why how we diagnose or symptoms of PCOD.
Okay, so you mean if any of these symptoms are there, so it's better to go and get it checked once with your doctor.
101%.
Okay, okay, Anjum. And when it comes to PCOD, so the first line treatment, as I have heard of it, is making changes in your diet and lifestyle. So, according to you, what are some of the food groups, or I would say some of the macros and micros that should be included in your diet if you are having PCOD?
I would say, with so much information available today on social media, somewhere the common man is confused on what information is reliable and what to believe, right? Because some nutritionists would say, "Hey, give up your carbs," and some would say, "Go normal and moderate on your carbs." So a person suffering from PCOS, like how I did, that time the information was limited, and
Yeah.
honestly, my doctor did not tell me about lifestyle modification. They just put me on hormone pills, and I was what, 15-year-old, popping in pills every day, and these were your oral contraceptive pills, which has lot of side effects. But unaware of the situation and the problem, and with limited knowledge, I was not aware. But today, what I tell my clients is very clear: moderate to low carbs work wonderful because PCOS is associated with insulin sensitivity. Chances to be falling into the range of being a diabetic or hypertensive is very high because of these hormones, where your estrogen, progesterone are not in the normal range, and you have higher level of testosterone hormones. So in that case, we ask our clients to not eat like a diabetic meal, but like a pre-diabetic meal plan, which is you are prone, you have high tendency. Another set of clients I know who didn't have information that they need lifestyle modification. So two macros of importance is good proteins and good fats. Most of the times I've seen people avoiding fats when they have PCOS, because see, it's like a vicious cycle. Okay, they think it's difficult to lose weight, so I need to cut down my fat,
Yeah.
and they cut down all good fats at the same time. Now, when you cut good fats from your diet, obviously you are hungry, that feeling of hunger pangs and that satiety is not there. So you end up eating more carbs, and then weight gain is still happening. So that frustration is always building up, not understanding which food group needs to be highlighted or which macro needs to be taken care of. So protein and good fats are essential, and moderate to low carbs would be great for great result basically.
Okay, so you mean these hormonal balance pills, as you were talking about, so there should be a no-no here, and rather you should focus on your lifestyle changes, right? Lifestyle.
100%.
Okay, okay. So, Anju, we talked about all the food groups that should be included in your diet. Now, what are some of the food groups that should be a big no-no, or I would say that should be avoided when it comes to PCOD?
You know, if you tell someone already suffering from PCOS that avoid this or limit this,
Yeah.
typically we don't do that. We ask them to monitor or eat it in moderation
Okay.
rather than giving them a list of do's and don'ts. But obviously, packaged and processed food, I would say, is the only option that I tell them is a big no. And sugar is the biggest culprit here. Otherwise, they are open to eat everything and anything that is cooked at home, is fresh. From macros, all your good proteins, all your lean meats, basically chicken, fish, eggs, paneer are really good options. Some clients, I would not say everyone, has issues with dairy, okay, with PCOS. But if you go with options like curd, buttermilk, paneer, and cheese, they also come with good quality of fats, like good fats that we talk about. So some who can digest well can also take in these options. But obviously, milk is something we do not recommend because of the inflammation, and many of them PCOS is also associated sometimes with lactose intolerance. So we avoid milk during this time. But other milk related products, if the individual is able to tolerate and is still seeing result, then fair enough, in moderate amounts, because at the end, curd and buttermilk will also contribute to the probiotics that we need. So that is also inclusive of the suggestion list that we do. But never go with deleting or eliminating a certain food group totally from your diet plan or your meal plan, because you need to have a balance of all, right? So your carbs, your proteins, your fats, your minerals, your vitamins, your water intake, your stress and sleep together will make a great result.
Okay. And Anjum, as you talked about this insulin resistance, so I've heard that people with PCOD, so they end up with binge eating or they have more sugar cravings compared to the other people. So, first of all, why does that happen? And secondly, what is the right approach here? I mean, how to strike a balance here? Because as you said, that people with PCOD, they can have diabetes in future, but they already
Yeah.
have these sugar cravings. So, what is the right approach here?
So see, many times it comes with that, oh, you need to eliminate a certain food groups
Yeah.
because you have PCOS. And when you do it for a longer time, the human inside, okay, then the normal mind, the normal human being inside you will always ask for a normal life, because I suffer from PCOS, and I know when I binge eat even for 2 days
Mm.
and I stick to my plan for 7 days, that 7 days of eating healthy is just not equivalent to eating unhealthy for 2 days. Your weight just shoots up, your face looks bloated, and you're like, oh, I messed it up totally. So that when you build that kind of craving and curbing yourself from something that you really eat or you love to eat, is something that you just let go and you binge eat it. So like you said, striking a balance is important, but how do you do it is the question here. uh, so I would say suggest that don't completely eliminate sweet based options from your diet. You can always have an alternative to sugar. Always have an alternative to sugar. See, sugar is not the solution to all your binge cravings, right? I mean, you can still enjoy cake, which is an healthier version of normal cake available, because again, sugar is what we are asking to eliminate. So a little more effort from your end in the sense of replacing sugar with any other alternative of sweetener that's available. So organic jaggery, honey, stevia, or date sugar, coconut sugar, all they have lower glycemic index than the normal sugar. And these are the options that we typically recommend a diabetic person, right? Or a pre-diabetic client. So then look on these options and the recipes. And today's time, you still find restaurants which give you healthy desserts. So it's striking a balance with that. And trust me, one reward meal out of your 14 meals in the entire week, let's say lunch and dinner, I'm talking about, that one meal will not really harm your 7 days of hard work. So when you say lifestyle modification, it's your food, it's your exercise, no matter what it is, where you are, what you're doing. But a balance in between both will really not affect that small piece of chocolate that you eat. So why not?
Okay. And this is what we are talking about, what to do after PCOD. But do you think following all these lifestyle changes that we have talked about, or all the diet changes that we have talked about, so if we consistently follow that, can we even prevent PCOD?
There are so many reasons that can be a contributing factor for someone to have PCOS, right? It's not just one. I would not say it's only lifestyle related. It's, of course, your hormones. It could be genetic. It could be stress in your lifestyle pattern. So, I know a set of people who eat healthy, exercise every day, but they do not have control on the stress levels. And then they're diagnosed with some issues. And someone who can manage stress, is exercising, is eating healthy, but genetic factors are as such where they have hypothyroidism, or they are diagnosed with PCOS. So there are a lot of factors that go into it. But yes, leading a healthy lifestyle, eating healthy, taking care of your health is the biggest investment, I would say, that anyone can make, right? So you'll never regret in any way. So yes, the chances or the percentage is very, very low to be diagnosed with PCOS if you have a healthy lifestyle. I would say very low margin of having chances being diagnosed, but it's not 100% guarantee that
Okay.
you'll not be.
Chances will be less, but still you can
Yes,
have it, all the other factors.
yes, yes.
Okay, Anjum. So to summarize, can you please talk about some other lifestyle changes other than what we have talked about as of now, like water consumption or sleep or any of the other changes that we can have in our lifestyle?
So just to conclude the whole session, someone with PCOS may think it's an expensive affair to meet a nutritionist to get your meal plan designed, because you have to buy supplements, you have to buy PCOS related packaged foods. It's a big no-no, I would say, because meeting a nutritionist will give them idea on what are do's and don'ts for them, what are their macros and micros that they need to follow. Apart from leading a healthy lifestyle, eating moderate amount of food and portion control, doing 30 to 40 minutes of active, any form of activity that you like. It could be dancing, or going to the gym, or just walking, running, just being physically active. Along with that, we do recommend to get a blood work done. That's your hormone blood profile, to check where you stand with your FSH levels, your prolactin, your testosterone, your TSH, your sugar levels. A detailed list is what I recommend personally. So you as a person is aware what is happening within the system. And if you're deficient in one of those parameters, we will try to correct it via supplements or via food. So magnesium, zinc, omega-3, vitamin D, B12 has played wonderful roles with our clients in terms of, you optimize these vitamins and minerals in the body. And then with healthy food and exercise, you tend to see great results. So someone with, let's say, acne issues, or someone with facial hair concerns, or someone who has a lot of pigmentation because of PCOS, then all these supplements works wonderful. Zinc actually helps reducing oil secretion from the from your skin, so they start seeing reduction in acne problems. Another thing is, people with PCOS also see a lot of bloating at times because the body has leaky gut syndrome or some form of inflammation. Then working with probiotics has done wonderful for them. Good bacteria, prebiotics and probiotics in combination works wonderful to reduce bloating and see greater result with your gut health. So whatever you eat after taking care of these gut cleanse that we do, you tend to absorb more food after that. And lastly, hydration. No matter where you are, what you are doing, 3 to 4 liters of water is a must. Lastly, it's your sleep and stress. To complete the whole program, most of the times we take care of how long do you sleep, what is the quality of your sleep, how's your stress level, how are your weekends, how do you relax, how do you feel when you wake up in the morning. Because if your body is restless, you're not giving your body that recovery time, I would say, or the shut and open time. And the body will drag through the day, and you just feel tired through the day. You are not able to focus, and that mental productivity with your hormone imbalance will take a toll on your health. So needs to be really, really emphasized that as much as your food, exercise, and other things are, stress and sleep is equally important for someone suffering from PCOS.
Okay, Anjum. Well, that was such an insightful session today. Thank you so much for joining me and sharing a lot of knowledge about PCOD, because I know that it will help a lot of girls and women because people are not aware of this. So, yes, thank you so much for joining me.
It's a pleasure. Thank you so